Our next speaker is Dr. James Newham, who is from King's College London, who's going to be speaking about his work with the Children and Young People's Health Partnership in Lambeth and Southwark.
Oh, yeah, brilliant. Okay, first of all, thank you very much for the opportunity to come and speak to you all today. So I'm going to be talking about the Children and Young People's Health Partnership, also known as CHIP, which some of you may have heard about. This is a large-scale population-level... okay, brilliant. Great. So it's a large-scale population-level model of care that's being implemented across Lambeth and Southwark for children aged 0 to 15 years of age. I'm the coordinator for the evaluation of the CHIP model of care, but I think it's important to stress that I'm representing on behalf of a clinical academic partnership which includes researchers, clinicians, project managers. Okay, and I'll just be presenting some initial data that we've got from one aspect of the CHIP project. Okay, so thank you, Raki, because you've really done a great job of setting this up, so I don't have to go too much into the background detail. But what I really want to stress is that I think, as was mentioned before, it's really important to consider the mental health and emotional burden that a lot of physical health conditions have on not just the child themselves, but often like the family, siblings, mothers, fathers, carers, etc. And then when you factor in the complexities of poverty, which a lot of children within the local area are experiencing, it becomes even more complex. Okay, so what can we do to try and improve this? I think a really important point to stress is that whereas we sometimes think that in the UK we have relatively a good model of care, it's been very much set up to deal with acute management of physical health conditions rather than dealing with long-term chronic illness and how we can better try to treat those people in the long term by providing better self-management to help them when they're not at their worst, and then that helps them better prepare for when they do experience exacerbations or flare-ups in their condition. And so when we talk about a fully integrated model of care, what that means is that we are looking at both the physical, the emotional, the mental burden, but considering it within the context of the family and the community in which they live. And so how is CHIP hoping to address this? So what we have is different strands of CHIP and the interventions that we're trying to implement. And those involve both targeted care for children with specific conditions, and these tracer conditions, as we call them, include eczema, constipation, asthma, and epilepsy. So conditions which are known to be improved by better proactive self-management. And how we do that is through care that is tailored to each child's physical and mental health needs. And what we try to do is far more like home visits or trying to organise care in an environment that is beneficial to the child and that family. And one of the things I'm going to be talking about a lot is health checks and health packs, which we've designed through, again, through this partnership between clinicians identifying what's important, but working with researchers to adapt that to using the most current evidence and the most effective validated measures. But then we also have strands of interventions which focus on a universal level so that all children within Lambeth and Southwark will hopefully benefit. So that involves trying to support both parents and professionals in managing common problems and minor illnesses, but also trying to develop what we call in-reach CHIP clinics, where GPs are working with paediatricians to try and enable learning from both perspectives. So you get that specialist intervention much closer to the child's care. So as I mentioned about the health checks and the health packs. So, and this was perhaps when I came on board this project, the most innovative aspect and got me really excited about CHIP is that what we're trying to do is proactively engage with families before the child gets ill. which, as I mentioned before, rather than waiting until that child has got so symptomatic that they're coming to the doctor, we're actually trying to reach them before that and trying to provide care that is proportionate to the level of need that they're experiencing. And so what we do is, for those that are experiencing low-risk symptoms, is that we can provide them with self-management advice and public health promotion material that hopefully can help them to manage their condition a lot better. And we've really done a lot of work to try and make these not very much like dry, educational, just information giving, because we know that those behaviour change techniques don't work in isolation. So we've worked with health psychologists to make the material a lot more focused on trying to get them to identify what their specific triggers are and how they can plan around that. But for those that are experiencing the need for care, they then get triaged to our CHIP multidisciplinary team, which involves specialist clinicians, psychiatrists, paediatricians, nurses, etc. So when I talk about the CHIP health check, what that involves is validated questionnaires which ask about disease-specific severity, about emotional well-being, but then what could be seen quite controversially, and I'd like to get people's ideas on it, is social factors. So we do ask them about things such as housing, food concerns, and the parents' well-being. So how do people receive these health checks? So anyone within Lambeth and Southwark can access a health check by going to their doctor in their surgery, asking about it. We have a lot of materials, flyers, advertising about CHIP within the practices, but also what we're doing now is directing patients to an online portal where they can complete the questionnaires, the health checks online. And then based on how they've scored, they then receive either the self-management packs, the coordinated care, but also it's important to stress that the families themselves receive tailored feedback explaining how they've scored on all these questionnaires, and a copy of that scoring is sent to the GP. So the idea is that that can both empower a patient, because actually it's like, rather than them saying, well, my child's ill, I don't quite understand it, it's they can say, right, this is how they've scored on a validated questionnaire. They are obviously not doing well. You have that same information on your GP system. So hopefully it can improve that coordination within the practice. So the bulk of this is actually just talking about some of the initial data that's come through the health check. So this was based on when we'd had about 3 months of rollout. And so it's just trying to look to see, are we actually hitting those hard to reach groups? So we had about 220 health checks returned. It's significantly more than that now. I think it's about 700, but I could be wrong. And what was quite surprising is that 86% actually came from the most socially deprived areas based on their index of multiple deprivation score. Whilst it could be argued that, well, actually Lambeth and Southwark is going to have a population that is going to be more deprived by default based on their IMD score, it's kind of encouraging, because it means it's not an obstacle, that actually people can, that are still engaging with the material. And that approximately a third were coming from white backgrounds, and there was a fairly even amount of patients responding across the age groups, whether 0 to 2s, 3 to 4s, 5 to 10s, 11 to 15s, etc. What we found was that roughly 11% of children actually reported more than one condition. So I think this is also of interest, because if a tenth are actually saying that they've got asthma and eczema, which might, for me, they seem quite completely different symptoms and symptomology and triggers, etc. But actually, there's a lot of common psychological triggers that can exacerbate both conditions. So actually, with an integrated model of care, if you're trying to treat both, it's like trying to look at what can work for both. And bearing in mind that we weren't targeting people that were symptomatic, but actually we found that 60% had poorly controlled asthma, 72% had like clinically significant constipation, and that 76% had moderate to severe eczema. And I think what is really startling is that, again, we were targeting people based on their actual condition, but approximately a third had high to very high scores on the Strength and Difficulties questionnaire, which is our measure of emotional well-being. So these families had a lot of emotional distress going on with the children. And then what we also found was that roughly 2/5 reported housing concerns, 8% reported not having enough access to food, and that a quarter reported problems paying household bills, and that of the parents, 12% expressed concerns about their own mental health. Now, there's lots of interesting factors about this, like, you know, are we being too invasive by asking these questions? But we also really stress to parents that they are not obligated to answer these. But actually, the fact that a lot of people were declaring this in a questionnaire is quite interesting, because actually there's a lot of fear about you know, that mothers are often concerned about, is this going to invite social care involvement by any declaration? But actually, I think what we've shown with this integrated model of care is that they know that they can get support to help with these factors, whilst also looking at the mental and the physical health conditions. So to try and understand uptake, we did some case studies with some of the practices that were really high responders. I'm not going to talk about the low responders because that would be a bit of a name and shame. But I think what was really interesting is that there wasn't, whereas I was believing that it would be like the big, large practices which would take this up because they have the systems in place, it was actually practices from some of the really deprived areas that were taking this up. And it was, what was common in all these practices was that there was a champion within those GPs that recognised that children's health was important, and that there was a lot of inequity that needed to be addressed. And I think what was really interesting is that all the practices came up with their own different approaches for how they got people to take up the health check. So there were post-it systems, putting records on GP systems, ringing up families, but these were all developed by the practices themselves. So that's good to see a 0 when I'm on the summary. So just to summarise, what we're finding is that predominantly deprived, black and minority ethnic groups were experiencing symptoms that warranted clinical intervention when we looked at a population level. And that many of the parents expressed concerns about their own mental health and social factors that they were experiencing. But what we're finding is that the health checks themselves may be a useful system for helping GPs in their clinics and for prioritising the concerns of the families and the patient. And so where we're going next is in the rollout of the CHIP model of care to practices through contacting them ourselves. So not just those that are coming to practices, but a system we call Call Recall, where we're actually ringing, texting patients that are registered to GP practices to try to get them on board. To see where, and it'll be interesting to see whether we get the same level of complexity and unmet need when we're looking at this wider population level. That's it. So if you've got any more questions or just want to hear a bit more, feel free to contact me. Please look at our CHIP website. You can access the health check there. So anyone that has children themselves with any of these conditions, that would be great. And also follow us on Twitter.
Any questions for Dr. Newham?
Could you say a little bit more about the champions within the GP services? Because this strikes me as a key and really interesting, important role.
Yeah, so I think...
How are they trained? So, yeah.
Well, this is it. It's not that there's official training. It was actually, it's more, when I use the term champions, it's more the fact that there's just someone within that practice. It could be a GP receptionist, it could be a GP themselves, it could be practice manager that really recognises, like, right, we're getting these children that are coming in all the time, and actually they're coming in for these issues of asthma flare-up, but we know it's that there's really poor housing conditions, and that's the issue. And actually the fact that we're offering something which looks at those social factors is what makes it they're like, oh, okay, this is what works, this is what is needed, so they're pushing it. So I think it's not in any way any formal training, but it's just people who have a real passion and see the need for this. And it's, if we can tap into that, that's a kind of elixir. Yeah.
Okay. My name's Vaughn, and I'm a service user. Basically, the question which I got to ask is about, there's a lot of kids which are having sensory problems with others, with other things like learning disability as well, together. How are you treating those? Well, a lot of them have been left behind.
Yeah.
That's it.
So I think probably the most relevant in our sort of cohort patients that we're looking at is perhaps those with epilepsy, and I think they're really misunderstood population within Lambeth and Southwark, that actually, you know, that people think about the epilepsy, but actually there's a lot of comorbid, like learning disabilities, sensory problems, the impact this has on the parents who are caring for those children. And actually it's, you know, it's by having the capacity within our nursing team, it's like uncovering this minefield, and it's like, but we're doing a lot of work in our process evaluation of interviewing these families, trying to find out what is the thing that works, and also speaking to our clinicians and finding out, you know, what do they do in certain situations, so that we can provide lessons learned that we can say outside of Lambeth and Southwark. Hopefully it can give guidance to practitioners.
Hello, I'm based in Newham, so right next door to you, where we're looking at health inequalities because of the makeup of our population, and children and young people is one strand. So there's kind of a commitment by our mayor who wants to do it. I just wondered, I've got two questions. How do you go from having a strategic commitment to having something that actually happens? And two, how much does it cost and how's it funded?
Oh, nice quick one. Yeah, it is very complicated, and our partnership has a lot of investment from the CCGs, from the local authorities, and you know, getting this set up has taken years in the process. And but part of the evaluation is that we actually want to try and document some of the learning that comes from trying to get people on board. And you know, I mean, it's really, yeah, it's hard to explain all the pitfalls and that, but it's, yeah, I'd say that, you know, getting this set up is a project in itself, just getting that buy-in. But I think what is promising is that, I mean, it's not promising in that things are bad, but in a way that people are starting to come around to the idea that prevention is really important, that actually a public health approach is needed, and that actually just looking at health in isolation isn't going to work in the long term.